My name is Bertha Harrison, and good afternoon. I'll see my plan too. So it's a line shot a GP versus my DHP Shilando, the slide that she made us. Some of the easy version. What if I say check? 45 Okay, my name is Bertha Harrison, and I just set my plan. And I'm a case manager for the Navajo Nation Breast and Cervical Cancer Program. And out of that program, we have 5 units, 1 in Chinle, 2 the city, Pianta, Winslow, and then 45 is here. So within the program, we have a case manager, and the girl that was sitting here is the data entry clerk. And she enters all the normal to abnormal results into the Women's Health database. And I take over the abnormal and try to follow up on all the abnormals that are coming to me, the referrals. And I do home visits, and then we provide one-on-one education with the patients here in the hospital, and also community education outside. So that's what I do.
I want to just add, just because she's not busy enough, she's also volunteered to be part of our new DNA breast cancer prevention training program. So as you can hear, people here aren't just working, they're really working all the time, and we're very grateful to have Bertha, who's just really been such a great help to us in building the program and bringing people in and sharing her own knowledge and contacts. So thank you, Bertha.
Good afternoon. My name is Peter Lance. Thank you, first of all, thank you very much for welcoming me to the nation. I'm very privileged to be here today. I'm a physician. I have a fabulous title called Chief Cancer Control Officer in the Arizona Cancer Center, which means that essentially I have oversight of all of the cancer prevention-related programs. I've also been fortunate to work closely with colleagues here. In fact, we use a telemedicine service that does work. We actually we've introduced. I'll be talking a little bit about this tomorrow. We've introduced virtual colonoscopy for screening for colon cancer. Since we launched the service here at 45 in Tuba City in May of 2008, we've now screened about 400 people for colon cancer. So they have the scans here, and then the scans are transmitted to be interpreted at University Medical Center in Tucson. So that's interesting, hopefully help develop it. So anyway, thank you all very much for that.
Thank you.
That's wonderful. I'm going to just turn around here.
My name is Jennifer Pettigo, and I'm a clinical nurse here in the multi-services unit.
Hey, I'm Tim Flood. I'm with the Arizona Department of Health Services in Phoenix, and our unit in Phoenix with the health department runs the state cancer registry, which keeps track and records all the 25,000 or so cancer cases that occur in the state, and hopefully we're including all the Navajo cases that are coming up here being recorded in the nation as well. I started in Georgia, went to New Orleans, ended up in Phoenix. It's taken a while to get here. I've been in Arizona for about 4 years now.
Thanks, Tim. Thanks for coming up. We love having you.
Good afternoon, I'm Mike Mendoza. I'm here from Delta Dental Arizona Foundation, and just here to give, if anybody didn't get one of these things, let me know, because I've got a lot of them. It's got some good stuff about oral cancer. And a little bit about myself. I'm an Arizona native, lived here my whole life, but I've never been to this part of the state before. And it's very beautiful over here, and thank you for watching.
I'm Megan Ross. I live in Chinle, which is kind of over the mountain across the valley at the mouth of Canyon de Chelly. I'm also a nursing student with the American Indian program of Northern Arizona University. And I've been spending the summer in Phoenix at Mayo Clinic doing a summer internship. And through one of the lab investigators met Barbara and said, oh, please let me come to Fort Defiance with you. So it's great.
Didn't take much to get me to convince me. That's great.
And ironically, actually, I've done a couple of clinical placements here in Fort Defiance, so very much like coming home.
I just wanted to, back to the basics here. There is a sign-in sheet for CME. David. Oh, yes, David. Sorry, David.
Hi, I'm David. I shoot video. I've been helping Barbara with this project. And it's been great to connect and have people share things openly. It's been pretty cool to have that and be able to get the word out to you guys and an interesting way to network. This project has just been, from my end of learning as a video, to just get out and network. It's been pretty neat. So I just think that you guys are all doing great stuff, and any way I can help.
Yeah, I commandeered him at his own wedding. We had a few champagnes together, and before you knew it, he would say, yeah, I'll go. And he's wonderful, and the work he's done both last year at Fort Defiance and then at our Myeloma conference in March, it's just great because it's on YouTube, and it's really been helpful for people who are learning about us to really have access to the actual programs, the doctors, the scientists, the presenting, patients being able to share their experience. So thank you, David. And I just wanted to remember to
Rodney, introduce yourself.
yeah.
What you been here?
Oh, hi, I'm Rodney Gorman. I'm the ICU nurse manager. What else you want to know?
What else are you willing to tell us, Rodney?
Oh, where I'm from?
Who's your girlfriend?
Oh, I'm married. Don't tell my girlfriend.
Right, that's the right answer.
Yeah, and I'm one of those guys that's from all over the place, but before here I was living in Omaha, Nebraska. And I'm a Husker. Forever.
Great. I just wanted to finish this one statement. It's important, if you would, to sign our sign-in sheet that Meg has for us. We do have CMEs available, so Meg will come around. We have an evaluation so that you can fill that out and get your CME CVUs, and then also get a certificate. We'll be doing this again tomorrow, and Meg and Tricia will be sitting next to the registration tables for people who want CME, so that we can make that happen for everyone. So that I just wanted to remember that, because sometimes people get all involved and interested in maybe when we don't have their information, and and again, we want to keep you as part of our network. We won't share it with anybody else, but you will be part of our database, and you will hear from us, because we're finding that that's how people find us and find you and find projects that interest them, because we are working in some other areas, obviously myeloma, but also we're doing work in it's called tissue donor awareness, and we're trying to encourage cancer patients to learn about how they can donate tissue for possible research. And we're going to be doing a program in September. So we're letting you know about it, because even though it's in Phoenix, everybody knows somebody that we want to make sure you hear about it. We do our programs for free. We want to make them accessible to people. And it will be a half-day program in Glendale.